Hey everyone, there's been 5 key traps in 2025 that's really exposed a lot of seniors to some additional costs, and then also one that's coming in 2026 that most seniors are not aware of. Maybe you've experienced it, maybe you have not. We're going to be talking about that today. Plus, at the end, if you stick around, I'm going to go over the 5 major things you need to prepare for this upcoming fall in the 2027 AEP season. So what are the big 5 things that are traps that have occurred in 2025 that has shifted a lot of things into 2026? One of the things that we've seen in 2025 that occurred last year is that there was a huge shakeup when it comes to Part D. One of the things that were done by the Inflation Reduction Act, they created a cap of a $2,000 max out-of-pocket or cap, the true out-of-pocket cost that a person could spend up to. Now, we have talked about this in other videos, but basically there's a retail value cost of the medication that you're on that's kind of in the left column. You could have a medication that's a retail value of $1,000. That's a tier 3 name brand drug, and maybe you're only paying $45. Well, the $1,000 cost is multiplied by a factor of 25% because that's what Medicare uses as a standardized Part D percentage to go towards your max out-of-pocket or true out-of-pocket cost of the $2,000. So we saw this $2,000 cap. So for you guys that are taking a lot of medications, it really helps some people because January, February, and March, all of a sudden you went through what they call the initial coverage phase. So you have a deductible phase, phase 1, phase 2 is what your copay cost is. And then during those phases, the retail value times 25% was going towards that $2,000 max. So a lot of you guys would see you'd be paying copays for a short amount of time, and then you would be pushed into the catastrophic, which is the third phase. Now, prior to last year in 2025, there was a 5% cost for the catastrophic. Years ago, when I got into this business, there was actually a breakdown of cost and percentages and things like that. It was very complicated. And people that were on several name brand medications, especially like insulins, breathing medication for like COPD, would often expend anywhere from $3,000 to $5,000, $6,000 a year in medication costs. Well, that's been capped now in 2025. The max amount out of pocket would be up to that $2,000 max, which typically, in the worst case scenario, we've seen people pay $1,800 and something out of pocket to hit their max because of how the variance works on the retail cost. So that's something that's very important because pushing in here in a second, I'm going to explain what it's done this year when it comes to 2026 and prescription drug caps. The 5% was eliminated in 2025, so that is no longer there. MAPDs added and raised Part D deductibles. They began to add Part D deductibles for 18 years. I've been doing this. And out of those 18 years, this has been the first year in our market, the Middle Tennessee market in Tennessee, and most of the contiguous states around Tennessee up until 2025 never had a Part D deductible on Medicare Advantage prescription drug plans. So we're going to talk about what's happened in 2026 that's changed all that and what you're going to experience if you have not, as far as a bill yet, that you are going to incur if you're in certain markets. And then we've seen prescription drug plans for the last couple of years. Before, maybe they did not have a deductible, but now they all have a deductible. So that's all the way up to the max Medicare allocated amount. Each year that changes. I'll be talking about that in detail and a couple other things here in just a second. So with the Part D deductible that's occurred really across the board with most prescription drug plans in 2025, we saw that coming into 2026, I'm going to go over exactly what happened with the drug plan, what happened with the deductible, and then what's happened in the Medicare Advantage world that's shifted and changes so much that's creating this additional bill. So there's a Part D deductible that's been beginning to be applied over the last 2 years, and now we're seeing the evolution of that in all Medicare Advantage plans in 2026 that are in most of our given markets. We're seeing almost any of them start from about $100 to $200 all the way up to the max amount, which is $625 for the 2026 year. So another thing that we saw with Medicare Advantage, and we're seeing communications, there was a bill that was trying to be passed to implement in 6 key states prior authorization that would require for certain major surgeries and to have an authorization for the first time with the original Medicare. That bill got denied and did not pass. But typically when a bill is brought in, normally what happens in legislation, there is legislators that want to have that bill passed. And so a lot of times, like in the big, beautiful bill, there's things slid into that bill And we're not talking about that today, but there's things slid into every bill that's passed through because someone is saying, hey, I'll give you a vote if I can slide this into the bill and pass it with it. So I would suspect in the near future, original Medicare is going to lean towards a prior authorization structure, but we saw in the Medicare Advantage world, authorizations get tighter over certain surgeries, procedures. And honestly, I give this feedback. A lot of times people in the YouTube world, especially in communicating the narrative about Medicare, Medicare Advantage, and Medicare supplements, and why Medicare supplements are so much better because original Medicare typically does not require prior authorization. And Medicare Advantage plans with certain procedures and things like that can require that. So all that means, and in theory, what we're seeing right now is a restriction on plans or Medicare or anybody just saying, hey, you can just do whatever you want. There's not been guideposts and boundaries for Medicare, original Medicare, and then Medicare Advantage plans have had those, but there's not been implementation of systems and processes with the Medicare Advantage world. Therefore, it's been very confusing on prior authorizations. What I see happening this year and moving into the next few years is there's going to be a lot of cleanup when it comes to prior authorization, but you're going to see usually a narrowing, and typically they over tighten on something, they become too strict, and then they loosen that up and figure it out. But you're going to see authorizations. So if you are going to the doctor to have a surgery or procedure done, and you have a Medicare Advantage plan, I would say, encourage you to ask the doctor, is there authorization needed? And if the health plan turns that down, are you prepared to be able to appeal that? They can appeal it. They can expedite an appeal, and it comes back within 72 hours. The Medicare Advantage carriers, each time that you appeal it, it gets closer to what they call compliance, where it goes over into Medicare's desk. And they're going to approve that as you continue to appeal that. Now, the process to have the appeals and do all that stuff is sometimes conflicting and frustrating, but most of the carriers, a prior authorization is not that big of a deal, and it's something we're going to see in the future, a lot of changes. So one of the other major changes we saw in 2025 is the merging and exiting of a ton of prescription drug plans. So previously, prior to 2025, we had always seen about 35 different carriers with typically about, up to 100 plan options in any given market. So if you went into an area, you may have 14 prescription drug plans or up to 35 prescription drug plans. They usually had about 5 plan selections per drug plan. Well, now we're looking at about 7 key carriers with 2 drug plans. So it's suppressed down to about 14 plans in most markets. Now, the bad thing is, I'm going to give you a little life story that I just experienced. I had a client of mine call. We put him on a Medicare supplement plan and put him on a prescription drug plan. And he called and was asking about Farxiga. He's on Farxiga and was asking about his cost, the retail value. Now, our enrollment dashboard, we typically can put a medication or medications in, hit a button, and it tells us the retail value, the copay cost. It tells us all this expository information. And we explain, like, hey, when you go to the doctor, you're going to have a $45 copay, but that medication is a $1,000 retail cost. So 25% of that, $250, is going to your max out of pocket. And then we look at the chart below, and it tells us actually when they're going to go into the catastrophic phase, the stage 3 now of drug plans, and they have 0 cost. So it's very informative. Well, he called because he knows we can do that, and we're informative in customer support and service to our clients. And I said, hey, let me pull it up. I don't even know if I have access. So now what's happened is you have about 14 different plan options out there that are available, but we are suppressed and don't even have access to a lot of that in our enrollment dashboard. So if you call us or if you call another agency that you're working with, they may not even be able to pull up some of the given information because that has been suppressed completely off the market. Now, NAIFA, an organization, NAIFA, is actually NAIFA's Medicare division, is actually comprised of a lot of leaders, thought leaders and talking heads, VPs and executives with healthcare companies and then large marketing organizations like that we're a part of are actually trying to get legislation passed, and it's being passed in certain states. So if you don't have suppression in your state, great, but in certain states there's suppression and there's plans in those areas that we are not compensated for trying to enroll somebody, or there's even Medicare Advantage plans being suppressed. In other words, they're there, you can possibly enroll or not enroll. Some are in a holding pattern of trying to come back around and clean up authorization structures and managed care structures and things like that. So you're going to see a lot of changes this year in 2026, last year in 2025, and probably in 2027. I would just encourage you with those changes, you need to be able to have somebody like us walk you through, educate you, review your plan with the deductibles being implemented this year, with all the different changes going on. And I just had a client today that I jumped on the phone with. He's been a client for years. He lost his plan. So he tried to go use the plan, realized he had lost his plan. He got a notification letter, didn't really understand what it meant. So we walked him through the enrollment process and have him going effective February the 1st. But very frustrating times that we're in, and still I haven't brought up the main thing that you're going to be exposed to when it comes to a bill that most people don't know about in 2026. So one of the other major things that is occurring right now, and we are getting tons of phone calls calling in from clients, is they will say, hey, lisinopril is still a generic on pretty much all prescription drug plans. It's a 0 or tier 1, tier 2 on most formularies. But there's a lot of generics. So generic medication is a medication that's come out of its tenure with the contract with the manufacturer, and it's in a sense sold to the open market so other manufacturers can capture the formula, create the product, and put it on a generic level and sell it at a cheaper price. Thus, the name generic brand names. So with that, most generics in times past has always been a tier 1 or a tier 2 on your formulary. So if you have a 0 copay for tier 1 or a $5 or $10, $15 copay for tier 2, then you may see your tier 3, your name brand medications like Farxiga and things like that. You would see like a 40 or 45 or 47, depending on your plan you're on, you're going to have a tier 3 copay. Well, now what we're seeing is generic medications that have a high retail value cost. That means that drug could be $200 or $300 and you're only pay a $10 copay on a tier 2. Now it's getting shifted down to tier 3 because of the risk factor of the medication and the Part D plan or the Medicare Advantage plan that has the Part D formulary built into it, the MAPD plan. There's cost restrictions and they are having to assume responsibility to pay for a portion of that medication once you go into the catastrophic phase. So medications that before were generic tier 1 and tier 2 at a lower copay that have a higher retail value cost now are being shifted down into tier 3, which means you pay a higher value of the cost and it offsets what they're having to buy into when it comes to covering the cost of the medication. So you have the manufacturer, the pharmaceutical company that contractually has to pay a portion of that when you go into the catastrophic. And then you have the Medicare prescription drug plan or Medicare Advantage prescription drug plan that's having to pay a portion. And the Medicare Advantage plans are having to pay more at this point. So they are adjusting formularies, which is throwing a kink into a lot of you when it comes to your budget. You've always been $0, $5. I've got my medication filled and it was $15. Now all of a sudden you're paying $87. And it's a little bit of a frightening situation. Well, that hasn't even touched the tip of the iceberg. But really what I want to be able to share with you today, stick around, I'll be back in just a second to share with you one of the major things that most of you guys are not aware of that you are going to experience this year. So before I dive into this kind of mysterious bill that a lot of you guys are starting to experience, and most of you guys will experience if you're on medications at all, I want to cover some things that are very important real quick with you on medication that I'm going to read just some clip notes to kind of explain. So one is, understand the cap is annual. So once you meet it for that year, it's for the entire year. So if you meet your max of $2,100 this year, that goes from January to December. It restarts every January. So it's a calendar year of January through December. Cash versus in-plan fills. One of the things people are saying is, this was generic before and now it's a tier 3. I will use like GoodRx, and you can do that. Now understand the retail value of that medication times 25% is not going to go towards your max. So for us, we do the math with people. We go, here, let's look at GoodRx if you're going to use that for a couple of medications. And then let's just factor what the drug plan allows and allocates for your cost. So we have a software platform that tells us the cumulative cost for the year. So if they're like, hey, I'm paying $60 a month to get these 2 medications through GoodRx, and I say, well, you would only pay $58 here, and you're going to hit 0 by this month. And on GoodRx, you're just going to pay the retail discount value of GoodRx's discount program, you're not going to hit the third stage catastrophic. So that's very important now to do the math. If you don't have somebody to do the math with you, again, we typically can use our software platform that does that. We can explain and walk you through that. So that's very important right now. Tiers have jumped, like I said, and then there's also prior authorizations for certain medications. You just need to be aware of, if you can't get it filled, like, what am I supposed to do? You're probably going to have to get with the doctor to get an authorization sent from the doctor to the Part D carrier or Medicare Advantage. Some of you guys that have taken certain medications, but in times past, there's been less authorization or prior authorization that needed to occur. Now in 2026, it is getting worse each year. Referred or preferred pharmacy steerings. One of the things that we've seen is that in times past, historically, Medicare plans really push people towards mail order. And they had hooks to be able to pay lower costs and things like that. That's really gone away. There's still mail orders. So if you want to do mail order, just don't be looking for huge discounts, and some carriers do still apply discounts if you do mail order. But you always have access to jumping into a retail pharmacy of your choice. Now understand, you need to choose a pharmacy that's part of the network of your plan. There's preferred pharmacies. It's going to have the lowest costs. There's standard pharmacies. You're going to have a little bit of escalated costs. And then sometimes people will bill for out-of-network costs for medications. You need to make sure that you're using a preferred, at best, a standard. So if you're not doing that and you're going to a place that you've been going to for 10 years and they've come out of network with your drug plan, which is happening, and with Medicare Advantage prescription drug plans, sometimes they've come out of network and you're going in and you're paying a high cost because they're just filling the medication. Typically the pharmacist or the tech is going to communicate to you, we're not network anymore, or it went from preferred to standard. And then a lot of times, sadly to say, they will begin to kind of steer you toward what pays them back best. For reimbursements, a independent pharmacy is reimbursed based on utilization rates and all types of different rates. And we could explain that in a phone call, but you just need to be mindful that they're running a business and you're a client. And so if you come to them and ask them for guidance, they're going to guide you toward, a lot of times, what's going to cover your medication, but also what's helping them. A neutral party is like an independent broker like us. I don't own stock in the pharmacy. I don't own stock in you. I'm just here to be able to guide you through the process and determine what is your cost at the lowest point of entry when it comes to the pharmacy and things like that. Just be mindful, and then we're going to get right into this last major thing that's happening right now in 2026. Hey everyone, I want to interject this video because I talked about the actual 6 things you need to do to prepare for the AEP season coming up, which is going to be October, November, December of 2027 AEP. One is you need to read your ANOC. This is going to be a document that comes from your carrier, the annual notice of change. That documentation we talk about in other YouTube videos a lot of times and give details, but the ANOC is going to let you know of things like we just talked about. Is there have been adjustments in the medication costs, and they'll say in 2026 compared to 2027 and show you the changes. There could be copay costs in your Medicare Advantage, access to care for doctors, hospitals, things like that. Degradation of benefits for dental, hearing, and vision we're seeing across all plans. One of the side notes is on the ANOC is, what you used to think as like a food card or over the counter, now there's new legislation, and to qualify for food benefits, you have to be chronically specified as a chronic illness and classify into certain conditions to qualify for food allowance. So don't get hooked on that, but read your ANOC. Like, hey, this is changing, this is improving, this is degrading my benefits. Oh, the cost of my medication is going to go up. And then make sure you review. The second thing is verify every doctor and every prescription is going to be covered in your plan next year. Now, that's something we do with our clients. If you don't have a licensed agent, obviously you reach out to us. We'd love to help you, and we'll walk you through that process and make it seamless. You want to compare your total annual cost, what is considered the max out of pocket, and look at your copay costs and things like that. The fourth thing, decide in versus cash refills. So use your plan in network for pharmacies like we talked about, or at least a standard pharmacy, and watch out for the old days of using like GoodRx. It doesn't always add up to the lowest value anymore because of how the prescription drug plans are regulated and done now. And then be mindful that you have prescription plan options when it comes to a payment plan that's set up, the PPP. Ask your health plan about that prescription plan program that allows you to divide out 12 months of your medication costs so you're not incurring so much cost in the first few months. Or if you're paying a lot of cost out in 6 months, divided over 12, it can save you a lot of money when it comes to budgeting on a monthly budget. And the last thing is, know what your SEP options are. This is special enrollment period options. We're in the OEP right now, which is January, February, and March, which allows you to change from a Medicare Advantage to another Medicare Advantage, what we call like to like plans. It allows you to come off a Medicare Advantage plan, go back to original Medicare, go on to a standalone prescription drug plan, and then if you're past the age of 65, you can still enroll into a Medicare supplement if you pass underwriting. And those are questions that we can always help you with as well. Know that throughout the year, right now, we've had a huge ice and snowstorm in our area, and that creates an SEP in markets where electricity has gone out. If you have storms, you can ask, like, hey, there's a storm, I may have a special election. So if you're trapped in a plan beyond March of this year and you're trying to figure out, like, how do I change? Call a licensed professional that knows what they're talking about. They can explain the SEPs, and sometimes there are options to change. And if not, guess what? They can set up a time and migrate you into the right plan in October, November, December, which is the annual enrollment period. And know the SEPs. If you're moving into the area for the first time, there's so many different SEPs that allow you to change plans, and allow you, if you're losing coverage or you lost coverage, just like the client that I was sharing about earlier on a different video. He lost his plan, didn't even realize it. And then when he realized it, he called and said, hey, I've lost my plan. But he has a 63-day window to go onto another Medicare Advantage plan. He was a Medicare Advantage that lost, it came out, got pulled from the market. He didn't pay attention to his mail. We reached out to him. He didn't call back until January. And guess what? We put him on a plan that's effective February 1st. Be informed, make smart decisions, and then back to the show here for the follow-up on the last part of the video. Hey, most of you guys may have heard of the prescription payment plan option. So last year, Medicare implemented this PPP, prescription payment plan option. And what that does is, if you're seeing high cost because of, something went from a tier 1, tier 2 down to a tier 3 that was generic, and now you have a $45 copay, and then you have 3 or 4 name brand drugs that are a $45 copay, or sadly, some of those tier 3 drugs have been dropped into tier 4 and tier 5, which are typically a percentage base. So it could be 25% at tier 4, 30% of the cost. So if you have a retail value of, $1,000 drug at 30%, 25%, that's $250. It's going towards your max, so the true out-of-pocket cost of $2,100. But guess what? When you stack up that among 2 or 3 other medications and you have $400 or $500 of cost, then that can be like, hey, what can I do? So the prescription payment plan is an option where they take that cost of what your medications are going to be up to you hitting maybe the catastrophic stage in 4 months. They can take the total cost, divide it over 12 months instead of on a payment plan that you would have to pay out. If you don't pay it out, they eject you out of the plan. So just make sure you understand the guidelines of the prescription payment plan, but there are options there. You would call your prescription plan, if it's a Medicare Advantage plan or an MAPD plan or a prescription drug plan standalone, if you had a supplement and a standalone, you call the carrier and say, I am interested in the prescription plan program. So it divides out my costs. I can't pay several $100s in the first few months of the year. Now, sadly, what is happening with a lot of you guys is you're now being exposed to the new deductible that's on pretty much every drug plan, and then Medicare Advantage plans. In our Tennessee market, there's a lot of our clients over the last few weeks have been calling and saying, hey, I think I need something going on with my drug plan. I went to the pharmacy and I had to pay $240 before, and then I had to pay some copay. And like before, I used to pay like just my $0 to $5 in copay costs. What is causing the cost of medication? I thought you checked everything. Well, we've been reviewing hundreds of clients' plans in October, November, December. There's thousands of calls that come in and out of our office this year, and we reviewed a lot of plans. Well, we let people know you have a deductible now. Like one of the plans in this market has a $200 deductible, but some plans went all the way up to Medicare's max deductible of $625. So that means if it's a tier 3, tier 4, tier 5, it's subject to the deductible first. So if you have a $400 deductible, you pay the $400 deductible, and that goes toward the initial coverage. So you have deductible and then initial coverage. So if your copay used to be $45 for that medication, but it has a $400 deductible, you have to meet that deductible before the copay portion of the plan is going to kick in. So you're 5-tier formulary. It's deductible first, and then for the 5 tiers, whatever level of copay cost is. So 0 down to whatever it is. And so you need to be very mindful. One of the most craziest things that we're getting calls on right now is just like, whoa, like what am I supposed to do? And again, guys, if you have that situation, one, you have an open enrollment period that Medicare gives you that you can review. You may be on the right plan at the lowest cost, but you may not be, and you may not have gotten a review done. You can actually do that now. And you can just get with a licensed professional like us and we can review, because you may qualify for a plan that has a $200 deductible and lower cost, or it may have a little bit higher deductible and still be the outcome that you need for the entire year. And a reminder, and don't forget, this prescription plan premium program is available for anybody. If you're having struggles paying your medications, guys, it's one of the most difficult things to talk to somebody when they're struggling financially. I know inflation has occurred. As good old country people say, the price of milk and eggs have gone up, but we are seeing decrease in pricing and things like that, gas and a lot of great things going on in the economy. But hey, if you're getting stretched financially because of the cost of your medication, the cost of your plan and things like that, and you need a review, we would love to be the agency that walks you through what plan options are available to you in your area and what it's going to cost you the least amount of money and provide you the most coverage. If you need help, reach out to us. Until next time, guys, I'll see you on the other side.
Thank you.